Valley del Sol, Inspiring Positive Change. Presentation by SWU 291, Group Diversity. Introduction. Valley del Sol is a local organization whose mission is inspiring positive change by investing in human services, strengthening self-sufficiency for families, and building the next generation of Latino leaders. The agency was founded in 1970. Valley del Sol values preserving dignity for all, acting with integrity and honesty, empowering our community, and respecting differences. Valley del Sol strives to instill in the community hope, trust, self-worth, and social responsibility. Valley del Sol focuses on behavioral health, social services, leadership development, individual empowerment, and community empowerment.
My name is Kurt Shepard. I'm the Chief Operations Officer of Valley del Sol. In front of me I have 6 questions which I've been asked to answer about Valley del Sol. The first question is, what is the mission of Valley del Sol? Valley del Sol mission is inspiring positive change by investing in human services, strengthening self-sufficiency for families, and building the next generation of Latino leaders. It encompasses a whole lot. Basically, we provide a wide range of services for behavioral health and social services through contracts with the Maricopa County Regional Behavioral Health Authority, Department of Economic Security, and other funders. In addition, we have a contingent leadership program which helps folks learn about becoming members on boards and commissions, as well as dealing with issues that affect the Latino community and how to represent those on those boards and commissions. Valley del Sol was founded in 1970, and it came out of the need for folks in the Latino community to get their fair share of services that were being provided. At the time, the folks who founded felt that wasn't happening, so Valley del Sol was founded to do that.
How is it funded? Valley del Sol does all they can, through funding and advocacy, to continue to receive public and private resources to support the agency. Public funding comes from federal, state, and local. Private grants and donations have also been granted through places such as APS, United Way, BASHES, and the Virginia G. Piper Charitable Trust. Who do they serve, and what services are provided? Valley del Sol has grown to be one of Arizona's largest nonprofit, community-based organizations, helping men, women, children, families, and the elderly each year through counseling, substance treatment, support services, and leadership development programs. How are services accessed? Valley del Sol serves clients that are currently under the following guidelines. Title 19 are families that are currently receiving health care through access. Title 21 are children that are under kids' care. And CMDP, children that are rewarded to the state through CPS. Valley del Sol serves clients that are currently under the following guidelines. Non-Title 19, people who don't have any insurance and may be helped from limited funds from an allotment through our state. Private insurance will be accepted within this next coming year. How are services delivered? Services are delivered by referrals from teachers, police officers, healthcare professionals, and social workers. Client services that may be offered after an intake process can include youth services can include counseling, case management, medication monitoring, parenting classes, girls group for resiliency and self-esteem. Adult services, methadone, AA and NA classes, support groups, intervention support, counseling, and medication monitoring. How are services evaluated? By Valley del Sol themselves, by the Commission on Accreditation of Rehabilitation Facilities, U.S. Department of Health and Human Services, and the Substance Abuse and Mental Health Services Administration. How can services be improved? To keep ensuring all potential clients have equal access to available services at Valley del Sol, to educate the community on how they can help their neighbors find help in need, to continue advocacy at a political level for more funding as community needs grow. In conclusion, Valley del Sol has grown to be one of Arizona's largest nonprofit community-based organizations helping men, women, children, families, and the elderly each year through counseling, substance abuse treatment, support services, and leadership development programs. What does the future of Valley del Sol look like? Adding new programs for our changing communities, educational programs for our clients, and addressing services for a more diverse population.
We also have added a youth to adult transition program for folks from 16 to 21 years old. Because then again, in the behavioral health system, when a young person turns 18 years old, they transition over into the adult system. It's a unique thing that happens with this behavioral health plan. It doesn't happen in the physical plan, where you turn 18 years, it's cut off. You have to basically go to another system. But what we want to do is have a program in place when folks hit this age range, and we can start helping them transition and let them know what's going to happen when they go into the adult system, what services will be available, and also try to take those things which do work in the kids system, such as the multidisciplinary team, which we call the child family team process, and carry that over to keep the family involvement in their services. Because again, the idea is if the family stays involved, they're the one constant in this person's life. The family and those other folks who are involved in that stay involved. They can help them navigate the rest of their lives more successfully and not be so dependent upon
Any questions?